And we have Dr. Ali Strucker, pediatric otolaryngologist, here with us along with Maya's father, Matt, who's on the phone. Thank you for joining us.
Thank you.
And Matt, really quickly, because I know Maya's still recovering, how's she doing?
She is doing amazing. She had a nice nap yesterday, which she hasn't napped in several months, and she slept through the night. She's breathing really nicely, and as far as we can tell, the surgery went really well.
Hey, Drew, why don't we show everybody kind of how the tonsils can affect your breathing so much. So in the back of your throat, kind of on each side, you're going to see you've got a tonsil on each side, and a tonsil is just kind of lymphatic tissue that kind of helps fight infections. And when you get, normally it's going to be nice and small. You might get a little tonsillitis, strep throat, and they may get a little enlarged for a while, and then you get treated, you get better, and they go back down, right? That's how it's supposed to work. However, somebody that has chronic tonsillitis, it's kind of like chronically infected. They are just always big. And we kind of grade them, and we even say, they can even, when you look in the office, they're kissing. We call them kissing tonsils. They are actually touching. There is very little room for the air to pass. And then when you sleep, everything relaxes, and those tonsils even fall closer together and pretty much will obstruct completely the airway. And you get that really loud snort, and the child's not breathing for a few seconds, so they have to kind of wake up a little bit to get that muscle tone back. And then they kind of come out of sleep to start breathing again. And if you keep doing that all night, you really don't get a good night's sleep at all.
So what, Dr. Strucker, can we as adults learn from kids, since that's the entire concept of the show today?
Well, adults can have sleep apnea as well. Maya probably today doesn't feel great, but she's going to do well. An adult patient has about 2 weeks of really bad sore throat. They complain a lot.
Well, Dr. Strucker, thank you so much for joining us.